Do you have concerns about your health or optimizing your health? Maybe you've gotten a little bit older and you want to know, how can I live the next several decades of my life even better? And what can I do now to make changes that are going to benefit me well into the future? Well, if that's you, thankfully we have Ashley Dishion with us today. So happy you're here. And just a little bit about Ashley. She is the owner of Functional Now, a primary care and functional medicine practice. She handles patients all the way from birth to the end of life. She's a nurse practitioner that specializes in functional medicine with 14 years of medical experience. So like I said, so happy to have you with us here today.
Thank you for having me. Happy to be here.
Yeah, absolutely. And just a quick note, I want to say that we are going to be talking a lot about medicine and different ideas and so forth, and we don't want you to construe any of that as specific medical advice to you. We're always going to encourage you to go and talk to your primary care provider, a medical professional, before you do anything on your own. We're just having a conversation today. We're going to share some ideas, and really it's just for educational purposes only. So with that disclosure out of the way, I'll kind of jump right in and we're just going to have a conversation.
Okay.
So question one, just to kind of start us off, is many people entering retirement worry less about living longer and more about living well. From a functional medicine perspective, what are the biggest drivers of quality of life after age 60?
I would say probably inflammation, muscle loss or muscle mass, and sleep. So when we think about our life over time, we think about inflammation. And with inflammation, we can have issues with our insulin and diabetes. Also with sleep, we think about any concerns for sleep apnea. If we're not getting close to 8 hours of sleep every night, with getting close to 2 hours of deep sleep, that can actually worsen our health and lead to more chronic illnesses. A lot of the things we think about when individuals get into their 60s, 50s, 60s, 70s, we think about concerns for bone fractures, osteoporosis, osteopenia, and some of the things that are really important that I always encourage people to do, especially even starting in their 30s, is to work on strength training, whether that is like going to the gym 3 to 4 times a week or walking 10,000 steps a day. Those are really important pieces. Something that's super simple that anyone could start today is when you get your shoes on in the morning. I would love for that person to sit down on the ground and put their shoes on.
Okay.
And then help themselves stand up without the use of another person or a chair. And the purpose of that is because it works on your core. And when we build up core strength, that can be extremely beneficial in providing better muscle mass, decreasing bone loss, decreasing risks of falls, because a lot of the things we worry about as we age are things like loss of independence, nursing home placements. And when you have better muscle health or muscle strength, that can be extremely beneficial in your overall health.
So that's really, so just sit down on the floor
Yeah.
and put your shoes on.
Yep.
And that honestly, that makes a whole lot of sense just from a practical perspective too, because yeah, like you're worried about falling, you're worried about being in a kind of a compromising position, and how do you get out of that and so forth. So I've often heard it said that the stronger live longer. Have you come across that phrase as well in like your practice and experience?
Maybe not that specifically, but at the same kind of ideas. Like
Yeah.
you don't have to have huge muscles or large muscle mass. It just has to be that you have to have strength. You have to have some form of strength to build the muscles around the bones. And anytime we become sedentary, that's when we have a loss of muscle mass, which leads to a loss of bone mass, and then we worry about the fractures and falls.
Yeah, so inflammation, making sure that you're working out regularly, muscle mass is what you said. Inflammation, muscle mass, and sleep are kind of like, not necessarily the top three, but at least they're in the conversation of like, hey, these are the things that you really want to be focused on as you age.
Yeah, I mean, those can all lead to deeper issues if those aren't addressed. So keeping it generalized, when I say say we're just focusing on sleep, individuals really need to focus on their amount of sleep they're getting. And if you notice that your spouse or you in particular are gasping for air or snoring at night, that would be a big indicator that I would have a concern for sleep apnea. And that's a good time to talk to your primary care to get a sleep study test. Other things like then you can go deeper in thinking, okay, well, I'm not getting sufficient amounts of sleep, or I feel fatigued. I feel tired when I wake up in the morning. I need a nap to get through the day, which is something I often hear patients talk about in retirement. I feel drained. I feel like I need a nap to get through the day. Really, we shouldn't. I don't like the thought process where providers tell patients, oh, you're just getting old. This is normal with aging. It's not normal with aging. I have lots of patients in their 70s, 80s, 90s that are living independently. They feel great. They don't feel drained all of the time.
Yeah.
So that was going a little bit deeper than you were asking.
Yeah, no, that's great though. That's great information to have. Yeah, just because like I care very deeply about this topic, and I have someone close to me that deals with a lot of health stuff, and so I've looked at a lot of this too, and I've heard it kind of described. I latch on to these phrases, because it makes it easier for me to remember, like the strong live longer
Sure,
thing.
yes.
I've also heard it described that like sleep is kind of like the vacuum cleaner for the brain. Like when you're sleeping, that's when your body has the opportunity to kind of like clear out the junk, that builds up, physically, in your brain and stuff like that. And like an inadequate amount of sleep, people in our culture, it's been bragged about a lot. How I only get 4 hours of sleep, I only get 5 hours of sleep, and there's plenty of studies to show that you can do that, but you dramatically increase the likelihood you're going to have cognitive disabilities in the future if you do that. So I definitely wouldn't want anyone to overlook the importance of that for sure.
Absolutely.
So,
yeah.
If someone is 55 to 65 and wants to be active and independent into their 70s and even 80s, and you kind of touched on this a little bit already, but what are some of the most important health habits they should focus on right now?
So I would say stay active. That's very important. And nutrition is huge. So often the traditional American diet is extremely suboptimal. So I like to look at blue zones, places in the world where people live the longest, the healthiest. What are those people doing differently? And the majority of those people, they're in community daily. So whether that's having dinner with your family members, or you're involved in a church group, or some kind of activity, that's very important. And their nutrition, they have a drastic reduction in processed refined carbohydrates. So breads, pastas, pastries, white flours, wheat flours, drastic reduction in those products. Higher amounts of olive oil or omega-3 fatty acids, and we can get those through things like, we can do supplementation, like omega-3 DHA, EPA, which is a good option. We can also do 2 tablespoons of olive oil daily, which could be a very odd thought process for someone to just start to drink oil. Chia seeds and flax seeds, it's super easy. You can add that into a smoothie or a salad every day. And then movement. All of these people that live in blue zones are typically moving pretty frequently throughout the day.
Yeah. Would you recommend as like a baseline standard, or if I get this wrong, what would you recommend potentially? Would you recommend it's important to get at least 10,000 steps a day? Is that kind of the number? Is there a range? What do you typically focus on?
Typically, I tell people 10,000 a day. So if somebody's in their 50s, they're probably still working. And so it's a lot harder for most jobs for someone to get 10,000 steps in a day. So I'll tell them, do the best you can. If you can get 5,000 steps in a day, and then try to do, even if it's just 10 minutes of strength training a day, that can be extremely beneficial.
Yeah, there's days that I get home from work and I'll look at my step tracker here, and I've got 3,000 steps. And I've been making it a point to get the extra 7,000, but it's a time commitment for sure.
It is.
When you only get 3,000 steps and you're getting home at 6 p.m. and so.
I tell people to get a desk that's a standing desk, so you have the option of standing up throughout the day. That can be really helpful as well.
Yeah.
Also, another thing that can be helpful in your 50s is getting deeper blood work. So traditionally, I think that we often go to our primary care and they check some basic labs, like maybe we call it a CBC, which is your white blood cells, red blood cells, the breakdown of the reds and the whites, and then a comprehensive metabolic panel, kidney function, liver function. Sometimes I get people that come to me and that's all that has been checked. And it's so important to look so much deeper, to look at things like an omega-3 fatty acid index, which has to do with inflammation in the body. and a CRP, which has to do with different kinds of inflammation, fasting insulin, hemoglobin A1C, fasting blood glucose, your nutrient levels like vitamin D, magnesium, folate. So that's looking like deeper into blood work, but it's so important because if we address nutrient deficiencies and inflammation earlier, like in our 50s, we're gonna have a drastic reduction of chronic illnesses later in life.
Yeah. Can you just take a moment and kind of maybe expand upon what you mean by inflammation, just in case someone doesn't like fully understand? I'm not even sure that I fully understand exactly like what kind of is meant by inflammation in general.
That's a good question. So you can look at inflammation in a blood work, and that would be inflammation like insulin levels, hemoglobin A1C, ferritin, CRP, and then you can also look at, if you're not even looking at labs and we're just saying, does this individual have inflammation? Is that kind of?
Yeah, I guess what I'm saying is like when I think of inflammation, I think of like the closest parallel I have in my mind is swollen.
Okay.
is that like what I mean, like kind of like I'm trying to think of how can I think of inflammation in a way that it makes sense to me, or maybe even makes sense to kind of the general population, because like that's what I correlate it to. It's like, oh, this is inflamed, right? Like I have a sore throat, my throat is inflamed, my throat is swollen. I'm sick, like my lymph nodes, like I can feel in my neck, are swollen. Is that an appropriate way to think of inflammation, or is there a different way to think of inflammation?
Yeah, we can look at inflammation in so many different ways, but yes, you're right. We can have enlarged lymph nodes. Often people think of lymph nodes in their neck. You can have swelling in your legs. That's often something commonly I'll see in individuals in their 50s, 60s. You could also, if you have, say you have a sprained ankle or something like that, right? You're going to have visible inflammation. Those are certain kinds of inflammation. You can also have inflammation in your gut microbiome. So when I say gut microbiome, that's referring to, we can think about our abdominal area.
Yeah.
So GI tract, everything from mouth to anus. And you can think of inflammation as, okay, sometimes I'll look down and my belly looks bloated after I eat. Some people will tell me, well, I don't know if I'm bloated. My stomach looks huge all of the time. So, but those are other signs of inflammation. Other ways of looking at inflammation can be things like brain fog. So if you're noticing frequently throughout your day, months, weeks, that you notice, gosh, I feel like I have so much brain fog. It's hard for me to recall words or gather thoughts. That makes me think, it's probably inflammation in your body. Okay. So it doesn't have to be a visible sign.
Yeah. We
can see inflammation in lots of different ways.
So it can present, so you might have inflammation that is internal to you that you don't see physically, but you will experience the symptoms
for sure.
of that inflammation.
Another one we think of for individuals as we get older, we think about cardiac health, so heart health. That's a huge sign of inflammation or concern for inflammation. So I think it's important when you're in your 50s to look at some of these cardiac markers, because we can see inflammation when you look at the right markers. So when you have a provider who's willing to look deeper, looking at things like a CRP and your insulin levels, and we can go a lot deeper, but looking at a lot of these markers, ApoB, that's going to look, and your lipid particle size, that can tell us a lot about the inflammation that's in the body. And if we address those in your 50s, drastically reducing inflammation and likelihood of having some kind of cardiovascular event, like a heart attack or stroke in your 60s, 70s, 80s.
Okay. Yeah, I was going to ask you, what are some of the consequences of like untreated chronic inflammation? Like, and is inflammation something that tends to compound over time as you age, or can it?
It can, absolutely. Yeah, it definitely can. It doesn't have to, though. If you're able to institute lifestyle changes like nutrition and addressing different kinds of serum markers, blood work markers, and movement, that can really help decrease inflammation. What was your question?
And it's also like, what are some of the risks of untreated chronic inflammation in the body?
So we also often think about diabetes, type 2 diabetes, heart attacks, strokes, and irritable bowel issues. So there's a lot of warning signs that people will have much earlier in life that can be signs of inflammation, whether that's difficulty swallowing or some heart palpitations, that's feeling your heart beating hard and fast, and swelling in your ankles, lots of different signs that can let us know there's something deeper going on. And addressing those issues earlier in life will drastically reduce your likelihood of having events later in your life.
Yeah.
Did I answer your question?
Yeah, absolutely. This goes right into the next thing I was going to ask is, in financial planning, we often talk a lot about, like, we talk a lot about taxes. We have really been emphasis on taxes, and just basically talking about how you might have a small tax problem today, but if you don't deal with it, you could end up with a very large tax problem in the future. And so, yeah, my kind of curiosity question is there something similar? Is there a similar concept in health where small issues in your 50s can create much bigger problems if they're ignored? Sounds like inflammation could be one of those things.
Yeah, I mean, inflammation is probably one of the biggest ones. I think fatigue and brain fog are some of the most common ones as well, that we think, again, same kind of idea, that we're told this could just be normal aging, but if we don't look deeper, often thyroid, like a suboptimal thyroid function, can be a huge change in your health. And if that's not something that's looked at with doing a lot more than, traditional medicine will do something called a TSH, checking that in your blood work. That's a thyroid stimulating hormone. That's great, but that does not give us a really clear picture of what's actually happening in the body. So we need to look a lot deeper and look at things like that TSH, free T4, free T3, thyroid antibodies, a reverse T3, There's so many different pieces to look at. Thyroid can have a big factor there. Inflammation is really, like, when you get really deep into, and we're looking at the core, like what causes chronic illnesses and cancers. Those are the things that most people are really scared of in life. And if you look at the root cause of those things, because that's what functional medicine does, we look at the root cause. Often we'll see it's inflammation in the body. Yeah. And if you can reduce inflammation in the body, you really can drastically reduce or reverse most chronic illnesses.
Well, I also think, like, if I do sprain my ankle and my ankle is swollen, my body's telling me something that there's something wrong with my ankle, right? So, like, if you have inflammation in other areas of your body, is that essentially like your body's messaging system to say, I'm bloated, right? Like, my gut's bloated, like my body's trying to communicate to me, hey, there's something not quite right here that, like, we're sending resources to try and fix, but sometimes your body needs help, fixing that issue, I guess, essentially. So, okay way to describe it.
Yeah. So, especially the thyroid. So I'm going back to the thyroid again because it's so important and it's often missed. Your alterations in your thyroid function is like we call it a canary in a coal mine. Yeah. So it's telling us, oh, there's something happening here, and it's not. And that's another thing with having a provider that looks at optimal levels. So maybe a traditional level for, I'll kind of pivot here and talk about a vitamin D. Vitamin D is so important to look at. And so a traditional therapeutic range is 30 to 100. Well, that's a huge range, right? In traditional medicine, I might have a patient who comes in and says, has their vitamin D that's at 30. And their provider would tell them, oh, your vitamin D is fine. That's fine. Yeah. Oh, no, I need your vitamin D to be minimum 50, closer to 85. That's optimal. That's going to drastically reduce your risks of osteoporosis, osteopenia, fractures. And those are all things that we worry about later on in life, mostly postmenopausal women, but also vitamin D, accurate or appropriate levels of vitamin D can reduce your risk of all chronic illnesses.
Okay. So there's a difference between your labs are fine versus your labs are optimal.
Yes.
Yeah, okay.
So I can't tell you how many times I have patients who will come in and see me and they feel really poor. They feel awful. And they're told by their primary care, well, your labs look great. I don't think there's nothing wrong. But then I look at their labs, just basic labs, and I tell them, your labs are not these are not good levels. Let's make sure, let's find out if you have an MTHFR gene mutation, which is just going really deep.
Yeah.
And that has to do with how B12 and folate cross the blood-brain barrier, how your liver organ over here on the right side of your body, we think of that as the garbage dump of the body, how it detoxes and pulls out toxins. And let's look at you, like really your vitamin D is 30, but I want it to be closer to 85. So taking a high quality vitamin D3, K2. We can go so deep, but it's just so important I can't emphasize that enough. When I think about optimal health for any individual, but especially as we're aging, is to look at deeper labs and to look at optimal levels.
Yeah. I have the MTHFR gene, and my wife actually has it too. Okay. And so kind of getting into that side of the equation is how important do you think it is, or what kind of emphasis do you put on having genetic testing done to seeing what maybe some of those predispositions you have to better understand that and kind of the way that your body's going to respond to certain foods or certain interventions, certain supplements and things like that? Do you look at genetic testing as like a foundational thing that everybody should have done, or do you think that you can kind of interpret what's going on outside of that? I was just curious kind of what your opinion is on that.
I think everyone at birth should be tested for MTHFR. It can be truly life-changing. I will say, because I do functional medicine, and some of the sickest patients I have, 95% of them will have this MTHFR gene mutation. Mutation, SNP, variant, they're synonyms for the same thing. And I truly believe that finding out just that one piece, that MTHFR gene mutation, can be really life-changing for everyone throughout life. So I test everyone for MTHFR, and I look at both of the genes and the SNPs in those genes. Also, another gene that's really important to look at is an ApoE gene. ApoE, we can correlate that with risk of Alzheimer's dementia, and that can be really important as well. And another thing I tell people is that the majority of genes, they're things that we have, right? That was inherited from mom and dad through birth. There's nothing we can do about our genetics, but then we can look into epigenetics. And epigenetics, think of it like a light switch. So that can be turned on or off based on our lifestyle, environmental exposures, and nutrition. So that's why I know I kind of kept it surface level at the beginning, but your nutrition and your movement can drastically change. So say you have this ApoE gene, high risk for dementia, Alzheimer's, that gene, that light switch can stay turned off, but it can get turned on with poor eating habits, with lack of movement, with very low omega-3 fatty acids. So there's so many things that we can do if we have that information.
Okay.
Knowing your family history can be helpful. That's great information, and it could put you at a higher likelihood. But if we have this evidence where we look at genetics, that can be really helpful for a very personalized care plan.
That I was interpreting based upon what you're saying is like, yes, you have a genetic predisposition, but your genetic predisposition does not mean predestination.
Correct.
So you have some ability, like you mentioned, the light switch, right? Like your environmental factors, the things that you choose or choose not to participate in could very much be dependent upon if that genetic predisposition ever becomes a problem for you or not. And I guess that was that epigenetic conversation that you were having, if I have that terminology correct.
Yeah.
Okay.
That's right.
So what are the earliest lifestyle, we're getting into this. What are the earliest lifestyle or lab markers you see that might signal increased risk for cognitive decline, and how early can people realistically intervene? So you already kind of mentioned like one of those ones to look out for is that vitamin D3, but are there any other early lab markers that you look at as that are not potentially in the optimal range that you would want to actually focus on earlier rather than later?
So cognitive decline is something that I would say the majority of individuals worry about as they age. And Yes, there are definitely different lab markers that you can look for. We can look for, sure, vitamin D, also omega, and literally an omega-3 fatty acid panel. So that's looking at your omega-3 levels that need to be at least 5.5%. And truly, most of the individuals that I check for this omega-3 level are well under that level. So increasing omega-3s can be extremely beneficial when we think about cognitive function. And we can look even deeper. So if there is a family history or a concern for cognitive decline, dementia, Alzheimer's, then we can look at things called so this is going to go a lot deeper, and it's called a p-tau. P-tau is going to look for your actual current risk for Alzheimer's dementia. We can look at an amyloid beta factors. We can look at inflammation, so CRP levels. Those are some other markers. Other things that truly have a factor with cognitive decline that's kind of outside of the Alzheimer's dementia have to do with hormones. So hormone optimization is really important as well. So I do work with patients with bioidentical hormone replacement, and there recently been removal of black box warnings on estrogen. Estrogen's so important. Estrogen and progesterone and testosterone. They're very important when we think about our brain and cognitive function, especially progesterone for females that can really help protect the brain. Estrogen can protect the brain as well. So I do believe that looking at hormones, sex hormones, so free and total testosterone, estradiol, progesterone, and DHEA, those are really important when I think about cognitive function as well, because truly that can, as we have a change in our sex hormones, which does happen over time, that can affect our cognitive function. Yeah, I think you asked about lifestyle as well.
Yeah.
Related to cognitive function, is that correct?
Yeah.
So I would say same kinds of things that we talked about earlier, as far as nutrition is very important. I tell people remove all foods, any kind of substance that has aspartame, potassium, and aspartame. These are sweeteners that are often put into our foods. They're banned in some other countries because they're directly correlated with cancers, neurotoxic, affect the gut microbiome. And those would be products that I tell everyone, remove this. This can actually truly affect your cognitive function. Also can affect your gut, can affect your endocrine system. So those are important pieces as well. Those are some lifestyle.
There's a lot of things that you can do. And I think honestly, and one thing that you mentioned before that I would think is important to bring back up is the community aspect of it. Staying engaged, right? Staying engaged with other people. There's so much behind just when you're talking to someone, you're not just hearing the words that you're saying, your body is reading their facial expressions, their body language and stuff like that. There's having conversations with people and being in community is far more engaging your mind. There's so much work that your mind is doing that you don't even realize it's doing when you're engaging with somebody else. You're mirroring their emotions, their facial expressions, and so forth. There's so much just they say 80% of communications that are nonverbal, right? So I would definitely just kind of bring it back to that too, the community aspect of it. And unfortunately, in our society, in our American society, that's just we don't operate in that traditional sense where you're part of a family compound,
Yeah, that's true.
So yeah, that's kind of an interesting thing too. When you brought up the omega-3 fatty acid thing, it made me think of something, and I just had a question. So I know my diet in particular. I do not eat fish. I'm not a big fish eater. And I know in some of those blue zones, and I don't think it's necessarily true across the board, and those blue zones being the greatest concentration of people who live to age 100 or beyond, for people who don't know. But they can have more of those fish and other things in their diet. Let me ask you more generically. Taking into consideration the standard American diet, right? What do you see as some of the most critical things missing from that standard American diet? and there's probably a long list, but but that's when you talk about the omega-3s, like that came to my mind, as potentially one of the major ones.
Yes.
Because I know I don't get that.
Omega-3s, yeah, we do traditionally think of that as fish. You can get it, again, through like olive oil, through chia seeds and flax seeds. So there's other ways to get it. Most people really do. So I'm going to kind of veer off a little bit. I'll come back.
Yeah.
There's two products that everyone can take that we understand you really can't overdose on: omega-3 fatty acids and creatine. Mm-hmm. Everyone can benefit from those, especially when I think about cognitive decline. Now I'm going into the creatine. Creatine can be extremely beneficial not just for bulking up at the gym, which is great. That's great if that's what your goal. Usually, most people in their 60s and 70s don't care about bulking up at the gym. They actually care about their brain health. And creatine can be extremely beneficial for cognitive function. So I typically tell people start off at 5 grams, which is usually 1 scoop daily. High quality creatine. Mm-hmm. Okay, and then you were talking about the traditional American diet. I do not recommend the traditional American diet at all. Often with our traditional American diet, we're consuming a lot of the things that I was referring to that really we just overeat: white flour, wheat flour, breads, pastas, pastries, buns, cakes, to an extraordinary amount that our bodies just weren't made to consume that amount of bread. Also, the kind of bread that we're eating is really suboptimal as well. Most of it is enriched with folic acid and just really suboptimal. A lot of the times I'll have patients that tell me they eat out 3 to 4 times a week. I tell people it's really not optimal to eat out that often. I would say pick maybe 1 time a week, and I understand having kids and activities, and maybe that's not pertinent to individuals in their 50s, 60s. Maybe their kids are older, but try to make most of your meals at home and really focus on protein. So eggs, chicken, fish, beef, poultry, cashews, almonds. Fiber, we need fruits and vegetables in our diet. That can help with phase 2 detoxification of the liver. So organ over here, like we talked about earlier, that pulls out toxins. And making sure you're getting fats. Often I think that we're told fats are the source of hyperlipidemia, high cholesterol. Is really not. Like, we need fat for our brains to function. And what I often see when an individual has high cholesterol, it's usually because of the white flour and wheat flour. And when they remove the white flour and wheat flour, we'll see a drastic reduction in their cholesterol levels. Yeah. So I would say with the traditional American diet, very suboptimal. I encourage people, remove all soda. Nobody should drink soda. There's zero benefit from drinking a soda. And if you need an alternative to a soda, I would say Olipop or Poppy is a way better alternative. Yeah. We're removing some of those sweeteners that shouldn't be in our body. And even with a regular Coke, that there's high fructose corn syrup, it's really not optimal for our body. Our bodies weren't made to consume those kinds of products.
So again, just a curiosity question, and we were actually talking a little bit about this before we even started the podcast here and started talking in the conversation. How do you recommend somebody balance the living their life versus like optimizing, I guess for lack of a better term, like optimizing for the best health that they could possibly be in versus also wanting to live their life and enjoy their life too, because you mentioned eating out, right? Like eating out, like in our American culture, like food, like what event do you have that doesn't revolve around food? You know what I mean? And
well, that's true.
Yeah, like going out to eat and so forth. I guess like I'm sure you've had conversations with patients about that and so forth. Yes. Is like what are those conversations like about, like I said, just balancing living your life versus, optimizing your health?
Yeah, that's a great question. So I always tell people progress over perfection. I can give all kinds of recommendations to say, don't ever eat out, always eat at home. That's great. And realistically, that just doesn't happen for most people all of the time. And I get it. Life is busy. We travel. We're going to see family. We're going on vacations. You're going to eat out. That's normal, that's expected, right? I would say, try to find a balance. So planning ahead of time is really helpful. So trying to food prep can be helpful to decrease the likelihood of eating out throughout the week. And then when you do eat out, it's okay to eat out. That happens sometimes. And there's certain times where we just can't mitigate that because of maybe a family member's in the hospital and we're spending time with them at the hospital. I would say just think about the choices you're making when you're eating out. So instead of ordering a soda, have a water instead. And when you're ordering a meal, try to balance the amount of protein. Try to get some protein in, so whether that's a burger or some chicken. And we can do swaps. So we can swap something like French fries for an asparagus or broccoli, salad. It's just it's a different alternative, and it's a different thought process. But once you start to change your nutrition and you realize how much better you feel eating a different way, you really just don't want to go back to eating the other way.
Yeah. We also talked about like those small things that can compound to large things in the future. And it's like, I think one thing that can happen with people is they don't realize how all of those micro decisions that they're making along the way are going to turn into macro consequences in the future. And like, yeah, like is the can of pop going to kill you today? No, but the can of pop that you drink every single day,
correct?
You know, and for a lot of people who do drink pop, it's not one can a day, you know, and so like that's really, you know, those micro decisions that don't feel like they have much impact in the moment can lead to those macro consequences.
Absolutely.
In the future.
And often I'll tell a patient, so say somebody comes in and they tell me, yeah, I drink 3 Diet Cokes a day. So sure, I would love for them to not drink any soda, but let's find something that's actually realistic. What's something where we can make changes that is a cultural change you're gonna stick with over the next month until we see each other again. So how about instead of drinking 3 a day, for the next week, you're just gonna drink 2 a day. And then the week after, if you can reduce to 1 a day, and just keep it at 1 a day until I see you next month. And building in those consistent habits, that's what's really gonna help someone get to their optimal goal, if that makes sense.
Yeah, and I've often heard like perfection is the enemy of good. You know,
you can't be perfect.
Exactly. Don't let trying to be perfect get in the way of your progress.
Yes.
You know, and it sounds like there's very practical approaches and steps that you can take.
Yeah, absolutely.
We touched on this a lot already, and I can tell you undoubtedly that this is true with the people that I sit in front of, but many people fear dementia more than they fear death or running out of money. I talk to people all the time, and they said, I will live as long as I feel good. Like, I want to live as long as I can. But if I can't remember who I am or who my loved ones are, like, I'm out. Like, I don't want to live any longer. So it's 100% true that at least in my observation, people fear dementia more than they fear death or running out of money. So again, we don't have to go through this all the way from A to Z again, but what are proactive steps can someone take in their late 50s to early 60s to take today to support long-term brain health? And maybe just give like a quick summary.
Yeah, so truly, I really can't emphasize enough how important it is to get deeper blood work to look for those concerns. And if there is a family history of Alzheimer's or dementia, to look at some of those markers like a p-tau or amyloid and inflammation, because we can find those, and it's not a definitive. So even if we see elevations in something like a p-tau level, that doesn't mean that level can't decrease. I've seen it decrease. I know that it can. So it's really important that if you have concerns, to address those as soon as possible by finding a provider who's going to look deeper into your blood work and help you with lifestyle changes. Did that answer your question?
Yeah, and it kind of going into something else that we already talked about a little bit was that's just you getting older. That's just you aging. You know, and you brought that up as it sounds to me that you would encourage people to not to take that diagnosis per se at face value. You know, it isn't always. It doesn't sound like maybe even in the majority of cases, it's not just aging. It's something that's going on that you can either fix or mitigate, it sounds like.
Absolutely, yeah. And doing anything you can to address those is really important, whether that's, looking at your labs or changing your nutrition or making sure you're exercising regularly, removing or reducing environmental exposures, decreasing smoking. That can have an effect on inflammation in the body, reducing alcohol consumption drastically. There's a lot of things that we can do that can mitigate concerns for cognitive decline. But I can't emphasize enough that if there's a true concern for Alzheimer's, dementia, that should be addressed as soon as possible, because there's so many things you can do earlier in life in your 50s that can drastically reduce the likelihood of those things worsening.
Okay. Many people picture retirement as travel, hobbies, and time with grandkids, but they don't feel as energetic as they expected. So what are the biggest hidden energy killers you see in this age group? So what are those energy killers you see?
So this isn't actually, there's quite a few things I can talk about there, but one of the most important ones is to just make sure when somebody is going into retirement that they have a plan for retirement, because retirement can be really hard. It's really hard. We get excited and we think, oh, when I retire, I'm going to sleep in, I'm going to relax, I'm going to spend time with my grandkids or friends, and that's great, and that's what we all hope for. But realistically, it's a big transition when you go from working 40 hours a week every single day since you were in your 20s to, well, I don't have anywhere to go tomorrow or the next day or the next day. And then there's this kind of loss of purpose. And when there's a loss of purpose, it can lead to depression. And that actually can be a huge energy killer. So I tell people, as you're prepping and you're thinking about retirement, have some kind of hobby in place. So every week on Thursday, hypothetically, I'm going to go do this hobby, whether it's some kind of like pickleball or a church group, or I'm going to watch my grandkids on this specific day. It's extremely important to have things in place. So important. And then when I think about, as far as like a functional medicine approach outside of that, I think of brain fog and fatigue. So often, again, we're told that these are normal things that happen with aging, but there's a reason those things are happening, and they shouldn't be happening. And they're kind of like hidden pieces in our health that we think this is just normal. But when you retire, you hope to have all this energy to do all these things. And if those pieces aren't addressed, like your fatigue and your brain fog, and we find out we address why you have them, that can really help as you continue into your retirement, 60s, 70s. Did that answer your question?
Yeah. So you need something to look forward to. You need something to anticipate. We spend all this time preparing financially for retirement, but you need to have a lifestyle plan for going into retirement. And I can tell you, just from my observation, the families that I serve that are the happiest and live the longest, and not only extend their lifespan but their health span the longest, are the ones who come in for a strategy and tactical visit with me, and they look at me and they say, Spencer, I have no idea how I ever worked a full-time job.
Yeah.
Like, I'm busier today than I've ever been in my entire life. They're just busier doing the things that they want to do. Yeah. But they've taken those steps. They're part of a community. They're going to. I have family members or families that I serve that go to the community center. They take painting classes. They're part of that community. They have church groups that are part of the community. They go to actually a different community center than what I'm thinking of here, but they play cards on a regular basis. There's pool clubs that people, billiards that people go and play. They join the YMCA. They have a group there that they work out with, and they're taking care of grandkids and things like that too. But and not to put a negative spin on it or anything like that. But I think what a lot of people don't realize when they go into retirement is I'm going to spend more time with my grandkids. But your grandkids also grow up too, and there's going to come a time where they're 13, 14, 15, 16 years old. They're in their 20s. They're having their own families. They're just becoming more independent. They're learning what it means to be an independent human being and so forth. And it's sad. It's sad to realize, but just how your kids grow up, your grandkids grow up too. And I think that there needs to be more thought into, yes, absolutely spend every moment you can with your grandkids.
Agreed.
But your grandkids do grow up, and so you need to also think about kind of what life looks like after that. as well. So I'm certainly, you mentioned you have people in their 80s and 90s too. Like they're kind of beyond that grandkid phase.
Yeah.
And now hopefully their grandkids still come and visit them, but it's probably not as frequent.
Sure. Yes.
They're not involved in the same sports that they once were. There's just kind of less opportunity there. So how are you going to derive meaning in your life after that? What's your community look like then?
Yeah.
So those are just things that come to my mind.
I agree. And I think it's great to be able to help your kids with their kids and spend time with your grandkids. I also, this is really like a personal decision, but I always tell people you don't have to go straight from working 40 hours a week to watching your grandbabies every single day of the week. It's really important that you enjoy your retirement, and not that spending time with your grandkids isn't enjoying. It's just, it's really important to find those things that you love, because just like you said, they're going to become teenagers, and most teenagers like to do their own thing, and they don't want to spend all of their time with their grandparents. So it is really important to have hobbies and things that you enjoy, things that you find interest in, and friends to spend time with.
Yeah. So someone who's getting ready to enter retirement, okay, and they say, I want to feel 10 years younger physically when I retire. So they want to enter retirement with a bang. I want to feel the best. I'm getting ready to retire. I want to feel the best that I can feel. I want to go and do the things while I have the time, talent, energy, and the freedom to do it. I'm healthy enough to do it. I want to enter retirement with a bang. What would you want them testing, tracking, or changing starting today?
I would really encourage very deep blood work testing, and you could see your primary care. There's a company called Function Health by Dr. Mark Hyman that tests over 160 markers twice a year for, I think it's like $365. And that's a great way to track a large amount of blood work markers that can give you a great information and insight into your health. That would be really important. Or finding a provider who's willing to test those things, but have someone interpret those results for you. And truly, like, going back to nutrition and movement, that I cannot emphasize how important that is. That is so important. By removing foods that cause inflammation in the body and reducing sugar, because sugar is something we can directly correlate with cancers and worsening chronic illnesses, and staying active every day. There's no measure on how important those things are. Yeah,
I mean, it's so funny, like so much about life is just getting back to the basics. I mean, you think about like the greatest athletes of all time, there's stories about Kobe Bryant where he would literally like just work on the most basic ladder drills and things like that. And people are like, why are you doing this, right? And it's like, he knew the fundamentals better than anybody else. So like if we can just continue to work on the fundamentals, like we will see improvement. And it's kind of interesting, like fundamentals and functional medicine, like there's like kind of a almost a little bit of a rhyme that goes along with that. And I kind of hear that echoing throughout this conversation. Is like our food has become way more industrialized. The growth of the internet is a wonderful thing, but it's made us more disconnected than ever. And and you can see how these things that have helped solve hunger and have helped made us more productive as human beings, they're not without their consequences. And we need to be aware of the consequences of those things. And they're showing up as chronic inflammation. They're showing up as fatigue and brain fog. And you have a choice. Like, you have a choice. Are you going to take the step to get the testing done, to do something about this? Are you going to take the step to be in control of your life and your health? And you have the option to do so. So with that in mind, right? So you have your own functional medicine clinic. So if people want to engage with you, if they want to learn more about your practice, what steps would they need to take in order to do that?
Oh, that's a great question. So individuals could go to our website, which is functionalnow.com, and there's a link to contact the office or schedule an appointment. And we have a great team that works with onboarding, even if it was just to answer questions, like what does an appointment look like? We have a great team that can answer all of those questions for you. So that would be the best way to get a hold of the practice. And I just drew a blank. I'm sorry.
No, you're good. I mean, if that's the best way, that's the best way to. So what was the website again?
Functionalnow.com.
Okay, so go to functionalnow.com. They can either they can find some more information there, or they can actually sign up for kind of initial consultation if they want to do that.
Yeah. So what they would do is they'd go onto the contact page, and that would reach out to our office. Within 24 hours, our office would reach back out to that patient, answer any questions they have, talk to them about membership or non-member options, and then get them scheduled.
Yeah.
So depending on what someone is looking for, some of us are scheduled out longer, some of us can get appointments. Some patients can get appointments with different providers sooner than later. But yeah, that's a great way to get a hold of us.
Perfect. Yeah, and like when we're talking about functional medicine, and this is something that like I'm extremely passionate about this topic, and I was holding back a little bit because I didn't want to dominate the conversation or anything, and but like obviously like you can tell, like I know that I have the MTHFR gene, and like I've gone down this rabbit hole. I've gone down this rabbit hole a lot because of, like I mentioned, someone close to me is dealing with a lot of issues right now, and yeah, as much as I can encourage someone, again, talk to your primary care provider. I don't want to overstep a line there, but as much as I can encourage someone to take the step to learn about their body at a deeper level and engage with someone like Ashley, I just don't see a situation in which you regret doing it. You're going to know yourself better. You're going to know more deeply why your body acts to a certain thing. There's just so many things that you can improve the quality of your life, and not just your lifespan, but your health span. How much longer you can have that quality for a longer period of time. So just from me to you, this is a path that I absolutely think is worth exploring. I've explored it in my personal life, and many people that are close to me have explored it. And so far, I've not had come across a single person that says like, I regret understanding my body better and dealing with some of those things that they've struggled with throughout the course of life. So,
yes, absolutely.
Anything that I can say to basically endorse the functional medicine side, like it's just it's the next phase. Like we had medicine 1.0, which was just basically understanding how things work. Then we kind of had medicine 2.0, where we got really good at dealing with acute care, and now we're entering into the phase of medicine 3.0, where we can really just, because of technology, because of a better understanding, we can really understand things more at just a deeper level. Mm-hmm. And it makes all the difference. It's made all the difference for a lot of people in my personal life and myself. So,
absolutely.
Yeah. So anything that you want to say in closing before we wrap up today? I really appreciate you being here.
I would just really encourage, look at your nutrition, stay active, find a provider who will listen to you. If you feel like you have concerns about your health and you feel like you're not being heard, there's lots of other providers. So find someone who's willing to take the time and sit with you and listen and talk about the most important things: your sleep, your bowel movements, how often you're pooping, your nutrition, and your stress levels. If you have a provider and they're not talking to you about those things, I encourage you to find another provider, because those are extremely important pieces of information.
Well, great. And again, just one more time, the website for you.
www.functionalnow.com.
Perfect.
Yep.
Well, hey, thanks for watching, thanks for listening, and we'll see you in the next one.
Thank you.